Hello, good morning, Mom Lean. Again, my name is Christine Natalang, and today I'm going to do a return demonstration on the different ways on how to prepare medication. Okay, the first thing is, of course, oral medication. Now, the purpose of this is to provide a medication that will have a systemic and local effect on the gastrointestinal tract or both. Okay, and of course, for the assessment, we have to make sure that we know the type of administration. Is it going to be orally, sublingual, or buccal? The allergies to medication by the patient. We also have to check for the client's ability to swallow, the presence of vomiting or diarrhea, as of course this will have an impact to the ability of the medication to be absorbed by the body. Specific drug action, client's knowledge and learning about the medication. We also have to make sure that we perform appropriate assessment like vital signs, and make sure that we determine if these assessment will have an influence to the administration of the medication. Now, for the implementation, we have to make sure that we know the reason as to why the patient is receiving the medication, the drug classification, the contraindications, the usual dosage, and at the same time, any side effects or any contraindication of the medication. We also have to check the MAR. We check for the medications, drug name, the dosage frequency, the route of administration, and of course the expiration date before we even administer. The rationale for it is because orders for certain medication expire after a certain period of time, and the prescriber may need to order another one. Now, if the MAR, for example, is unclear, or if pertinent data is missing, all we have to do is to compare the MAR from the prescriber's most recent written note, okay, or written order. Now, if you've seen any discrepancy, then make sure to report it to your charge nurse or to the physician. Now, we also verify if the patient is able to swallow or is able to take medications orally. And then after we've done that, we organize our supplies. Now, organization of supplies is very important because this will save us time, and of course, it will reduce the chance of error. Okay. Now, for the performance, of course, the first thing we'll have to do is to perform hand hygiene and any appropriate infection control procedures or measures. We unlock the dispensing system. We obtain the appropriate medication from the refrigerator, from the cabinet, okay? And then make sure that we compare the medication from what we have on the MAR, okay? The rationale for this is because, this is a safety check to ensure that we are providing the right medication to the right patient, okay? We also have to check for the expiration date because outdated medication is not safe to administer, okay? And lastly, you only use medications that have a clear and legible labels. This is to, of course, ensure accuracy. Now, after that, we prepare the medication. Now, in preparing the medication, make sure that you calculate the medication's dosage correctly and prepare the medications clean, okay? Because, of course, aseptic technique will maintain cleanliness of the medication. And then make sure that for the second time around, you check the label of the medication from what you have on the MIR, because the second time that we are doing the checking will of course have a higher chance of us reducing or avoiding any errors of administration.
The capsules or tablet, we have to place the package unit dose directly into the medications and do not remove from the package. And if using a stock container, we have to pour required amount into the medications without touching the tablets. And if necessary, we have to crack the medications to provide required dosage using the cutting or splitting device. And if a patient has difficulty in swallowing, we can check if the tablet can be crushed, because not all tablets can be crushed. And if the tablet can be crushed, it will only affect in 2 hours. However, within 4 to 6 hours, you will feel severe pain because of the uneven effects. And for the next, let's move to for all liquids medications. First is I'm going to mix it before pouring it into the medication cup. And then we have to check the color. And if there is any different color on the medications, we have to disregard it. And next, I'm going to remove the cap, and I will put the cap upside down to avoid contaminations of the medications. Next, I'm going to place the medications cap at the flat surface at the level of my eye, and we have to pour the medications at a desired level. And then, after that, before putting the cap into the medications, I'm going to wipe first the lip of this medication. The rationale for this is to avoid streaking from the cap. And then, as soon that I already wiped the lip of it, I'm going to put it back the cap. And if giving a small amount of medications, we can use the syringe without the needle, and we have to note for the name of the drug onto the syringe. And that would be all for the medications.
Okay, so basically that's about it. After you prepare the medication, make sure to label it as well, and then go to the bedside of the patient, and of course assist the patient in taking the oral medication. Hello there. So for today, I'm going to do a return demonstration on how to withdraw a medication from an ampule. So of course, the first thing we'll have to do is to do an assessment. We check for patient's allergy towards any sort of medication. We also have to check for specific drug action, contraindication, side effect, and at the same time, we check for the client's knowledge of and learning needs regarding the medication. We have to check as well the intended route, to make sure that we are using the right size of syringe. And at the same time, we also have to check for the ordered medication for clarity. We do specific assessment. Okay, we check for we check for vital signs, and then we determine if these needs or if these vital signs will have an impact in terms of administering the medication. Okay, now in terms of planning, we have to check the MAR, or the medication administration record. In checking the MAR, all we have to do is to check the label in the ampule, check it to the MAR, make sure that they are the same. Okay, and then you also have to check these three items. Number one is when the medicine has been taken before withdrawing the medication. At the same time, you also have to check after we have withdrawn the medication, and then we make sure after that we organize our equipment. So for today, I'm going to use, of course, an ampule. We are also going to use, of course, a syringe. So I'm using a 1 cc syringe. Okay. And at the same time, we are going to, of course, use cotton balls, this paper, okay, or use tissue paper later on for breakage. And at the same time, a container where we are going to put, okay, of course, the broken ampule, and at the same time the syringe. Okay, so starting with, of course, making sure that we perform hand hygiene. Okay, this is for us to avoid contaminating, or this is for us to avoid putting on microorganisms to of course, to the medication, to make sure that we are following sterile technique. Number two, prepare the ampule. Okay, prepare the medication on the ampule. So the first thing we'll have to do is to flick the upper part of the stem. So this is the upper part of the stem. Make sure that you flick it. The rationale for that is to make sure that all medicines will go to the bottom of the bottle. Okay. The next thing is that you make sure that you use an ampule cutter. Okay. Or you can also use an alcohol wipes, or antiseptic wipes. Okay, in breaking the ampule. Okay, make sure that you put it around the neck of the ampule. The reason for that is to make sure that we are not going to injure our fingers. Okay, so after we've done that, making sure as well that when you break the ampule, you do it, you break or you bend it away from you. The reason for that is because so that the broken glass, if in case, will go, of course, away from you. It's not going to be towards you. Okay, and then making sure that you dispose the ampule or the broken ampule to the right container. Okay, so I'll do it now. Okay, now the next thing you'll have to do, of course, is to put the ampule on a flat surface. Okay, now after we put the ampule on the flat surface, we make sure that we attach a filter needle on the syringe. Okay, of course, the rationale for that is to make sure that no glass particle, will be included on the medication that you will withdraw. And then after that, you remove the cap and insert the needle. Let me use this one instead. You insert the needle. Okay, avoiding you touching the rim of the ampule. Okay, of course, the reason for that is to make sure that we will keep the needle sterile. Okay, so after that, we hold the ampule slightly to the side. Okay, this will basically help us to get the medication easily. Okay, so let's do it. So we'll be needing 1 ml. Okay, so right now I already have almost 1 ml. Okay, so I already have 1 ml. So the next thing we'll have to do is to replace the needle. Okay, so we will now remove the needle, okay, the filter needle, and then replace it, of course, with a safety needle that will be used if in case you will be injecting this to the patient. Okay, but if you're just gonna put it on the IV, then you can just do this directly. Okay, use this directly, or you can also just use another needle to put it on the IV line of the patient. Okay, so make sure that, of course, by the way, once you put the medication on the injection, make sure to tap it. Okay, to tap it to make sure that you will remove the excess bubble and of course expel the bubbles and push the medication based on the prescribed volume. Okay, so discard any excess medication, and then of course make sure that you just follow the ordered amount by the physician. So basically that's about it. On how to withdraw a medicine from an ampule.
For the preparation of the medication from vials, in the planning, the equipment that we will be needing are the client's MAR, the vial of sterile medication, antiseptic swab, safety needle and syringe, a filter needle, and a sterile water or normal saline if the drug is in a powdered form. And for the implementation in the preparation, we would check the client's MAR, we would check the vials labeled to the MAR to prepare the correct medication, then we would follow the 3 medications check. We would read the medication first before taking it out from the cart, and we're going to read it again before and after the withdrawal of the medication. Then we're going to organize our supplies. Then, for the performance, we're going to perform hand hygiene. Then we're going to prepare the medication vial. If this is needed, we're going to mix the solution by rotating the vial between our both palms because vials may contain aqueous suspensions that settles at the bottom part. Then we're going to remove the protective cap. We're going to wipe the rubber cap of a newly opened vial with an antiseptic wipe in a circular motion. The antiseptic cleanses the cap and reduces the spread of microorganisms. Then we're going to withdraw the medication. We're going to attach the filter needle to withdraw liquid medications from MBVs. This prevents solid particles from being drawn up to the needle. Then we're going to ensure that the needle is firmly attached to the syringe. And then we're going to remove the needle cap and we're going to draw up air the same amount of the drug that we're going to extract. Then we're going to maintain the needle sterility when inserting it to the vial's rubber cap. And then we're going to inject air into the vial, keeping the needle's bevel above the medication. Inserting air will allow the drug to be pulled out easily, and keeping the needle's bevel above the medication prevents air bubbles.
Withdraw the prescribed amount of using either of the following methods.
Hold the vial down, move the needle tip so that it is below the fluid level, and withdraw the medication. Avoid drawing up the last drops of the vial. Proponents of this method say that keeping the vial in the upright position while withdrawing the medication allows particulate matter to precipitate out of the solution. Leaving the last few drops reduces the chances of withdrawing foreign particles. Or, invert the vial, ensure that the needle tip is below the fluid level, and gradually withdraw the medication. Keeping the tip of the needle below the fluid level prevents air from being drawn into the syringe. Hold the syringe and vial at eye level to determine that the correct dosage of drug is drawn into the syringe. Eject air remaining at the top of the syringe into the vial. When the correct volume of medication plus a little more is obtained, withdraw the needle from the vial and replace the cap over the needle using the scoop method, thus maintaining a sterility. If necessary, tap the syringe barrel to dislodge any air bubbles present in the syringe. Carefully and slowly expel the air and find any excess medication from the syringe, maintaining the needle up position. The tapping motion will cause the air bubbles to rise to the top of the syringe, where they can be ejected out of the syringe. Sometimes, when ejecting the air bubbles, the resulting amount of medication is less than ordered. Drawing up a little extra medication, as in the previous steps, help avoid these.
So the purpose of administering the intradermal injection is to provide the client medication requires for the TB screening and the allergy testing. Of course, prior to performing the procedure, we are going to prepare for the client's MAR. So we're going to check on the client's MAR or the computer printout. So we are going to check on the label of the medication if we are preparing the right medication. So we are going to follow the rechecking of the medication. Of course, when was the medication taken from the cart, and then before withdrawing the medication, lastly, after withdrawing the medication.
So we are going to clean for the side first. Ma'am, kalma lang po tayo.
So we are going to insert the needle slowly and carefully until it produces wheel. So when inserting a needle, make sure that the bevel is needle or the bevel needle up. So we're going to hold the steam until it taunts. So the taunt will allow us to insert the needle easily.
Intradermal.
Okay, now it produces wheel. We are now going to withdraw the. So after that, we are now, if necessary, we can put a bandage, and we do not massage the site that is injected because it may irritate the injected site, also the dispersion of the medication. So we are going to now remove first our glove. Hand hygiene. We are going to label the by encircling the site, and then you're going to observe it for 24 hours or 48 hours. So and then after that, so the time inserted was time is 12:02, and then we are going to observe it after 30 minutes. So we will be back after 12:32. So we're done, ma'am. Very good.
Iduro mo sa kanila, iduro mo sa'yo.
Sino na sumamit?
Ito yung schedule ni Robin kasi superficial lang ha.
You have to learn how to kasi actually ako pa siya tatagos ko.
Okay, that's enough. That's enough. Asan na yung ballpen mo? You mark it. You just cover that one. Kasi baka makatusok. Okay, and then you label. Masakit talaga. Oh, ilagay mo anong time. Ay, hindi. Yun lang maliit, ma. Hindi sa ano lang, sa pinusukan mo. No, it's okay. Oh, dito, yung pecha. Time started and time finish should be 30 minutes. If there is no allergic reaction, kung walang redness, kung walang swelling, walang itchiness. 30 minutes. 30 minutes. Again, I would tell you, pagka doubtful ka, you can repeat the skin test and you have to put a control. Dito siya, tapos meron pa isa dito na distributor. And then kung positive pa rin, tingin mo, you can do this.
For the purpose, to provide the medication the client requires C-specific drug action. For the assessment, client allergies to medication, specific drug action, side effects and adverse reactions, client's knowledge of and learning needs about the medication, tissue integrity of the selected site, client's age and weight to determine site and needle size, client's ability or willingness to participate, and determine whether the size of the muscle is appropriate to the amount of medication to be injected. An average adult's deltoid muscles can usually absorb 0.5 ml of medication, although some authorities believe 1 ml can be absorbed by a well-developed deltoid muscle. The gluteus medius muscle can often absorb 1 to 4 ml, although 4 ml may be very painful and may be contradicted by agency protocols. For the preparation, first check the MAR, check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. Follow the 3 checks for administering the medication and dose. Read the label on the medication when it is taken from the medication chart, before withdrawing the medication and after withdrawing the medication. Confirm that the dose is correct. And second, organize all the equipment needed.
Now perform hand hygiene and observe other appropriate infection prevention procedure. Prepare the medication from an ampule or vial for drug withdrawal. So I have here the syringe with the drug. Whenever feasible, change the needle on the syringe before the injection, because the outside of a new needle is free of medication. It does not irritate subcutaneous tissues as it passes into the muscle. Invert the syringe needle uppermost and expel all excess air. Provide for the client's privacy and prepare the client. So prior to performing the procedure, introduce self and verify the client's identity using agency protocol. This ensures that the right client receives the medication. So assuming that I have a client here, so assist the client to a supine, lateral, prone, or sitting position depending on the chosen site. If the target muscle is the gluteus medius, have the client in the supine position. In the lateral position, flex the upper leg, in prone position, toe in. Because appropriate positioning promotes relaxation of the target muscle. Obtain assistance in holding an uncooperative client. This prevents injury due to sudden movement after needle insertion. Next is explain the purpose of the medication and how it will help using language that the client can understand. Include relevant information about effects of the medication. The rationale for this is information can be facilitate acceptance and adherence to the therapy.
Administering a subcutaneous injection. The purpose to provide the medication the client requires to allow slower absorption of medication compared with either the intramuscular or intravenous route. For the assessment, allergies to medication, specific drug actions, side effects, and adverse reactions, client's knowledge and learning needs about the medication, status and appearance of subcutaneous sites for lesions, erythema, swelling, ecchymosis, inflammation, and tissue damage from previous injections, ability of the clients to cooperate during the injection, and previous injection sites use. For the planning, administering subcutaneous injection is an invasive technique that involves the application of nursing knowledge, problem solving, and sterile technique. Therefore, this skill is not assigned to AP. The nurse, however, can inform the AP of the intended therapeutic effects and specific side effects of the medication and direct the AP to report specific client observation to the nurse for follow-up. For the equipment, client's MAR or the computer printout, vial or ampule of the correct sterile medication, syringe and needle, antiseptic swabs, dry sterile gauze for opening an ampule, and clean gloves. For the preparation, check the MAR, check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. Follow the 3 checks for administering medication. Read the label on the medication when it is taken from the medication cart. Second, before withdrawing the medication. Then, after withdrawing the medication. Lastly, organize all the equipment.
So for the performance, first we need to perform hand hygiene. So after that, we need to wear gloves. So let's just pretend that I already wear a glove. So let's proceed with the preparing of medication from the ampule or vial for drug withdrawal. So for the drug withdrawal, check for any discoloration and also the expiration date. And then wrap the clean gauze around the neck, and then you have to break it like in a snapping motion so that parts are away from our body. And then you have to throw this one on a sharp container, and then you have to insert the syringe on the ampule. Make sure that the ampule is in steady and flat surface, and then you have to get remove it and turn it around. So you have to flick it slightly just to get out the air bubbles out, and make sure to always double check the dosage and avoid medication error. So the next thing we will be doing is to provide client privacy. So let's just pretend that I already provide the client's privacy. So let's proceed with the preparation of the patient or the client. So in doing this, you need to introduce yourself first. So ma'am, I'm Trisha, your student nurse for today, and can I please check your identification band just to make sure that I'm with the right patient. So let's just pretend that this bear is a patient. So ma'am, let's proceed with the next procedure wherein you need to be in a comfortable position while doing the assessment to avoid any discomfortation while I'm injecting the medication. So obtain assistance in holding an uncooperative patient to prevent injury due to the sudden movement after needle insertion. The purpose of this is to administer medication that must be absorbed into the bloodstream slowly and it must be steadily. So in doing this procedure, you will feel less hurt or less pain due to we will just be use a short needle in doing the subcutaneous injection.
So for the procedure 6, so now we'll have to select and clean the site. So we'll have to select a site without discomfort, hardness, swelling, scarring, itching, burning, or inflammation. So for the rationale, these conditions may limit medicine absorption and increase injection site irritation. Then we'll have to apply clean gloves if it is possible, and then we'll have to clean the site with an antiseptic swab, and then we'll have to begin at the site center and clean it outward and then dry. The rationale is that manual swabbing will eliminate skin secretions containing bacteria. Then we'll have to hold the swab between the non-dominant third and fourth fingers or place it on the client's skin above the intended site. So this keeps the swab accessible once the needle is removed. Then, now we'll have to prepare the syringe for injection. So while the antiseptic dries, we'll have to remove the needle cup, straighten the cup to avoid contaminating the needle's edge. Then we'll have to dispose of the needle cup. Now we'll have to inject the medication. So we'll have to hold the syringe between the thumb and the fingers and then inject with the palm pointing sideways or up for 45-degree angle or down for 90-degree angle. Then pinch or spread the skin with the non-dominant hand and then push the needle in with the dominant hand. So if the client has more than half an inch of adipose tissue, the skin can be stretched at 90 degrees. And if the client lacks adipose tissue or subcutaneous tissue, we'll have to insert the needle at the 45-degree to 60-degree angle. Now, we'll have to move the non-dominant hand to the plunger after inserting the needle and then hold the syringe firmly and slowly depress the plunger. So for the rationale, a steady syringe and consistent pressure reduces the client's pain. Then now we'll have to smoothly remove the needle while pressing the skin with the non-dominant hand because depressing the skin reduces needle withdrawal pain. And after giving the medication, a safety syringe, the needle remains in the bottle. If bleeding occurs, we'll have to apply gauze until it stops. So now we'll have to dispose of all the supplies appropriately. So we'll have to discard the needle and also the syringe on the sharps container. So I'll have to remove it because the proper disposal will reduce injury of the nurse. So I'll have to put it now here on the sharps container and also the plastic. Then afterwards, now I'll have to remove my gloves. Then afterwards, we'll have to perform hand hygiene. So I'll be using the ABHR or the alcohol-based hand rub. Okay. So now, lastly, we'll have to document all the relevant information. So we'll have to record the test material, the time, the dose, the route, the site, and also the nursing evaluation because the nurse notes are utilized for PRN drugs or specific problems. Then we'll have to document the medication's effectiveness at the estimated time of effect or the expected time of effect.